There we go. Thank you. All right. Good morning, and thank you all for joining us today. I want to welcome you to the California Department of Public Health Childhood Lead Poisoning Prevention Program's Lead Week webinar series. My name is Kevin Wagner, and I am the Communications Consultant with the Childhood Lead Poisoning Prevention Branch. This year, our Lead Week series will focus on lead in drinking water, especially during lead service line replacement. In addition to our presentation today, you are invited to join us for two more presentations this week. On Wednesday will be the Childhood Lead Poisoning Prevention Branch and the California State Water Resources Control Board Division of Drinking Water. And then on Thursday, we have a presentation by the California Department of Social Services and the California State University of Sacramento Office of Water Programs. Both presentations will start at 10 a.m. Pacific time. And before we go ahead and start our presentation today, I'm going to go over some of our webinar settings and features, just so you're familiar with them. So you are aware, this webinar is going to be recorded today. And then the audience will be muted to allow our speakers to have an uninterrupted and respectful presentation environment. There are a few chat features that are available for you to use, though, however. In the bottom right corner of your screen should be a button called the Q&A, and that will allow you to type in questions that you may have for our presenters, who will be answering those questions at the end of our webinar today. And then you also have captions and translations which are available, and that's going to be the button down on the left-hand corner of your application called or titled CC. And this will allow translations to appear in over 100 different languages. And then we also have the regular chat feature, which is available in case you have any questions or any problems with using any of these functions throughout the webinar today. And next slide, please. So today's webinar will focus on the work of the Lead Service Line Replacement Collaborative and includes information about their health equity initiatives and a matchmaking survey that connects local public health professionals and water utilities. At the end of the presentation, the speakers will be available for questions for about 30 minutes. As I stated before, we're going to be recording this webinar today, so that our webinar recording will be available on our website, which is listed on the right-hand corner of your screen. And then I will also put the link into the chat so you can easily click on that to find that. So with that, I will go ahead and hand it over to the collaborative to begin our presentation. Thank you.
Thanks, Kevin. Can everybody hear me? Awesome. All right. Good morning or afternoon, depending on where you're joining from today. I wanted to start off by thanking the California Department of Public Health for inviting the Lead Service Line Replacement Collaborative to speak today and to kick off Lead Poisoning Prevention Week. My name is Roya Alkafaji. I'm a manager at the Environmental Defense Fund, a global environmental organization working to build a vital earth for everyone. During today's presentation, we will ground our conversation in how lead gets into drinking water and the basics of lead service line replacement. From there, Amanda will walk us through the importance of collaboration in lead service line replacement, and Lynn and Mason will wrap us up with a really great overview of how to enhance equity in lead service line replacement. And just a reminder, if you have any questions during today's webinar, please drop them in the Q&A and we'll get to them at the end. Next slide, please. So for those of you who may not be familiar with us, the Lead Service Line Replacement Collaborative is a joint effort of 28 national public health, water utility, environmental, labor, consumer, housing, and state and local governmental organizations who are working to accelerate full removal of the lead pipes providing drinking water to millions of American homes today. I'm joined by 3 other members of the Lead Service Line Replacement Collaborative who are also experts on issues of lead in drinking water. Next slide, please. Next one. To start off our conversation today, we'll look at why lead exposure from drinking water is an important issue and how it gets into drinking water in the first place. So I just want to start off by saying that there is no safe level of lead exposure. Lead is a toxic metal that can cause serious health effects in all age groups. However, it's particularly detrimental to children because their brain and nervous system is still developing. Children are also more vulnerable to lead exposure because of their unique behaviors. For example, young children may put contaminated objects in their mouths, exposing them to more lead. In children, lead can impair normal brain development, contributing to learning and behavioral problems, hearing and speech problems, and slowed growth and development. Adults can also see an increased risk in cardiovascular disease and high blood pressure, along with kidney and nervous system problems. So, where does lead come from in our environment? The most common sources of lead are lead-based paint, which, while it was banned in 1978, still remains in an estimated 37 million homes across the United States. Soil and dust is another common source. Lead can get into the soil from deteriorating lead-based paint, as well as past emissions of leaded gasoline, which was banned in 1988. And drinking water, which is why we're here today, is another source of lead. Installing leaded plumbing was largely banned in 1986. However, there was no requirement to actually remove the leaded plumbing that was already in place. And an estimated 20% of our exposure to lead can come from drinking water. This percent rises if you're an infant drinking mostly mixed formula. This can go up to 40 to 60%. And finally, some food and consumer products and imported goods can also be contaminated with lead. Next slide, please. So how does lead actually get into drinking water? This slide provides you with some more detailed information on how this can actually happen. It is important to note that lead rarely comes from source water or the water that's coming from your water utility. Instead, often lead gets into drinking water from service lines that are made of lead or from internal plumbing that contains lead or has brass fixtures or fittings with leaded material. Lead from these materials can get into your water when something called corrosion occurs, which is when the pipe material actually starts to wear away. Water utilities try to prevent corrosion by feeding chemicals into the water that help create a protective coating on the inside of the pipe. However, lead can still be disturbed and wear away. Out of all of the potential sources that you see on this slide, lead service lines are the largest potential source of drinking water whenever present. Lead service lines deliver water to your home from the water main in the street. They were banned, along with other leaded plumbing materials, in 1986. But if you live in an older home, you may have one of these lines connected to your house. All right, so to ground the rest of today's topics, we'll talk about some key concepts as they relate to lead service line replacement. So the image on the next slide shows the typical infrastructure that delivers water to your home. The service line, as I mentioned, is the pipe that connects the water main under the street to the interior plumbing in a building. Common materials used for these service lines may include copper, galvanized steel, and lead. And when present, lead service lines contribute the greatest percent of lead to the tap. However, it's difficult to test exactly how much lead you may be exposed to from these service lines because lead particulate can unpredictably get released into the water. With the reduction of lead in new plumbing material, the best opportunity for reducing the risk of exposure to lead in drinking water is to actually remove these lead service lines. So in the next slide, one of the main guiding principles of the Lead Service Line Replacement Collaborative is to encourage and accelerate full lead service line replacement across the country. So what do we mean by full replacement? Oftentimes, service lines are seen as split into two parts. There's the part from the water main to the curb stop, and then from the curb stop to the actual home. However, research has shown that partial replacements are likely to actually increase lead levels for up to 6 months at the tap. And that's why the goal should be to only conduct full lead service line replacements whenever possible. So if you're like me and you're curious to find out the material of the service line at your own home, there are a couple ways to do this. First, sorry, next slide. Thank you. First, you could conduct a visual inspection. Actually, NPR has a really great interactive tool at npr.org/pipes. You could also hire a licensed plumber to come in and inspect the material, or you could contact your water utility. These are just a few ways that if you're curious, you can go and find out the material. All right, so what goes into a lead service line replacement program if one was to be implemented in your community? The first thing that you need to do is actually inventory and find out where the service lines are in the distribution area, and then what the material types are. The second thing you need to do is to secure funding and policies to facilitate full lead service line replacement, as well as plan and coordinate lead service line replacement in your community. The most important thing would be to strive for conducting full lead service line replacements and implement any measures in the meantime to reduce risks to homeowners and residents. And the last thing, which arguably may be one of the most important components of a lead service line replacement program, is to actually communicate with customers about lead service line replacement happening during planning and implementation. So lead service line replacement really is a moving target. And I think it's important to mention EPA's lead and copper rule because this is really the backdrop for water utilities. First established in 1991, the lead and copper rule, or as you may hear it being referred to as the LCR, regulates lead and copper under the Safe Drinking Water Act. And in January 2021, EPA published revisions, also known as the LCRR, which go into effect in October 2024. You can learn more about these revisions at the Lead Service Line Replacement Collaborative's website, or reading up more on it at EPA's website. I do just want to mention that the LCR isn't necessarily just focused on lead service line replacement, and it's rather more of a last resort as part of the rules. Next slide, please. So under the LCRR, all systems will be required to inventory all service lines in their distribution area and list the material type. Inventories will need to be made public, and large systems that serve over 50,000 people will actually need to post these inventories online and make them available to the public. I want to mention that the California Water Board asks systems to submit their inventories and have them posted in an online map. I do just want to point out that this map only reports the material type on the publicly owned side, or as I mentioned previously, this is the part of the line that runs from the water main to the curb stop. So it could get confusing if you're looking at that map for residents when they say that when it lists that they have a lead service line, you know, getting that notice versus looking at the map could get a little bit confusing, but I do just want to note that this map is available if you're curious and want to go check it out. So we do have a poll for folks to take, and I think we're going to get that poll up for you in just a moment here. The question is, I don't know if I can actually see when the poll is posted, but I'm going to go ahead and read out the question. So this is a true or false. Partial lead service line replacements can actually increase lead levels in water. Is this true or false? And then you'll have 30 seconds to answer the question, and then I will reveal the correct answer. All right, I think it's been about 30 seconds, so we can go ahead and end the poll. And the correct answer is true. Partial lead service line replacements can increase lead levels in drinking water, so that's why it's really important to conduct full replacements whenever possible. All right, so just a couple other notes on the Lead Service Line Replacement Collaborative and the resources that we offer. So the collaborative developed a roadmap for communities to use when thinking about lead service line replacement. There are 4 main elements to the roadmap, ranging from funding to legal factors to consider, and there's even a really nice set of questions to ask whenever designing a full lead service line replacement program. So, you know, this roadmap is available at our website, lslr-collaborative.org. And then on the next slide, lists out just a few other really helpful resources available to communities, including resources available in Spanish, examples of other communities who have implemented lead service line replacement programs, webinars, and more. So definitely please go check it out. And to wrap us up here, I just want to note that the collaborative's resources are for everyone who may be interested in lead service line replacement in their community, community leaders, elected officials, drinking water professionals, public health professionals, which we'll learn more about in the next section, as well as concerned consumers. So the collaborative's resources are for everyone, and I really hope you take some time to go check it out. And with that, I will turn it over to our partners at NCHH.
Hey everyone. Yeah, my name is Amanda Reddy. I'm the Executive Director of the National Center for Healthy Housing and a proud member of the Lead Service Line Replacement Collaborative. I'm going to speak a little bit, as Roya mentioned, about the importance of collaboration here. And if we could move to the next slide. I'd like to acknowledge that, you know, on that slide, Roya just showed that all of the stakeholders listed there are really important to this process and to this conversation. But I'm going to spend a few minutes talking to you about the unique importance of the relationship between public health and water utilities and how that relationship can really impact and benefit outcomes for the consumers and residents that we serve. Next slide, please. And I think it's also worth mentioning that this engagement between public health and water utilities isn't just beneficial for lead service line replacement. It absolutely is essential to that process, but it also has lots of other potential benefits across other health issues, you know, so that building this relationship now can help this process of lead service line replacement, you know, really maximize the benefit and the impact on communities, but it can also help build the infrastructure in a relationship that might be needed to navigate other types of crisis or issues or opportunities that emerge to make sure that the residents that we serve have continuous access to clean drinking water. So building this relationship has this immediate benefit on lead service line replacement, but also has wider benefits as well, and is definitely worth investing in. Next slide, please. So, and we may have skipped a slide here, or maybe we just got them out of order. Go ahead, but that's fine. But next slide. I'll just move forward to talk about some common opportunities that we see for collaboration between public health and water utilities, include partnering together on messaging and awareness, right? Using your different networks, your different methods for getting message out to consumers and residents to make sure that they are aware of the potential hazards of lead in their community and connection to resources. And that's connected to the second point we see on this slide highlighted here as well, that it's really an opportunity for public health and water utilities to come together and to really provide a more holistic message to residents. You know, I come from the public health side of this equation, and many organizations, mine included, have historically focused very heavily on exposure to lead in paint, lead in dust and soil when we're working with communities, because that is such a significant driver of lead exposure for many homes, for many families, for many communities. But it's also true, I'm going to speak to those of you in the audience who are public health professionals who may be involved in programs like that. If we think about going into the homes of the average resident and doing what feels to them like a very comprehensive investigation, we're looking at their soil, we're giving them messages about, other lead hazards, we might even be talking to them about toys or spices or other things that they're using. If we're not talking about lead in water, right? Residents may not know to ask about that. And we're sort of leaving them with a false sense of complacency, right? A false sense of security that we have thoroughly and comprehensively addressed lead. Maybe in our own minds, we understand and we think that that's somebody else's purview, somebody else is on that. But from a resident's perspective, it really benefits them if we can partner together to provide this more holistic message about the potential for lead exposure, as well as knowing about how to connect consumers and residents to resources. Similarly, to my colleagues in the water utility space, right? Making sure that residents understand that just because their lead service line is replaced doesn't mean that their potential for lead exposure has ended is really going to help drive the impact that we want to see in our community. We also see a lot of really important innovation and collaboration around the use of data. So data can be used to help with the designing of these lead service line replacement programs and tracking and monitoring them to make sure that they are implemented, they're designed and implemented and targeted effectively and equitably. The public health colleagues on the line again today, I will say you have a lot of assets that you bring to the table that you may not even be aware of. Over my time with the Lead Service Line Collaborative, being in the room with other water utilities, I've come to learn that, a lot of what seems very obvious to us, a lot of the data that we have regular access to, a lot of the thinking we engage in every day about how to use this data to think about targeting resources in our community, it seems really obvious to us, but it may not be as obvious to some of your colleagues who come from the water space. And folks who work for water utilities, your public health departments do have access and experience with figuring this out. So if that's something that you're concerned about wrestling with right now, how are we going to roll out this program? How do we know where to start? You have some ready and willing partners in your public health departments. That also sort of carries over into the next bullet on the slide, really thinking about the opportunities for presenting lead hazards, for those water utilities, for instance, as you begin to make some of your inventories more public, stand-up maps and other types of inventories, we have an real opportunity here, again, to present a more holistic message to the public. And so when people are going to your website to find out information about, do I have a risk? Is there possible that I have, lead in my drinking water? Do I have a lead service line here? That we can give them information about other lead risks that may be present based on the age of their housing or other lead sources, based on where their home is located. And there are many, many ways of approaching this, but we really have an opportunity here to streamline the process and the messaging for residents. You can imagine yourself, just to put yourself in a resident's perspective, would you want to have to go to a water utilities website and a health department's website and all of these different websites to try and piece together the information and the risk for your family? Or would it be, more impactful for you if you had one place that you could go and get really concrete information about your own home and what resources exist in your community? And then the final category of activities that we see a lot of collaboration around is around testing water and providing filters. And this can go both ways, right? So we can see that that public health programs, many times you have lots of programs that are going into people's homes, and you can use that as an opportunity to initiate water testing there or get people connected to services that might help them test their water. Similarly, we have examples from other communities. I believe in New York City, for instance, the water utility, when they have a positive result, when they find lead in drinking water, they proactively notify the health department. So there can be this really synergistic opportunity to increase the number of people who are getting access to water testing, as well as sharing information about the results of that test. And if we could move to the next slide, I'd like to highlight two examples here. There are lots of examples and stories from around the country of what this looks like in action. I'll just share two here to show how really accessible, how reachable these kinds of strategies are to put into place. I'll also offer an invitation that if you have examples of what is working in your own community, please share it with us, either in the chat today or in the question and answer, or reach out to one of us on the Lead Service Line Collaborative. We'd love to add your own story to help pave the way for other communities. But just sharing a few examples from communities across the country, starting with our colleagues in Cincinnati, Ohio. There, the health department conducts water testing during public health lead investigations. And that may seem very obvious to those of you who have not spent a lot of time in the public health world or around lead investigations, but that's not necessarily standard practice in doing environmental lead investigations for public health departments across the country. But they initiate the water testing there. They also make referral to the Greater Cincinnati Water Works if they identify that a lead service line is present while they're in the home doing that investigation. Again, public health departments, you have that access, you're actually in the home. That's really incredibly invaluable access to information there. And they include information about lead and water in their awareness materials. They also partner together, the water utility and the public health department. They seek funding together, they partner together on outreach and participate in a coalition together. And similarly in Denver, we also see there that the Department of Public Health refers homes to Denver Water, the utility there, if a child presents with an elevated blood lead level and the investigation uncovers that there is lead in the drinking water, so that the utility is then able to take over and work closely with the family to prevent that exposure to lead in water and get that corrected. So the public health department doesn't have to take on that whole issue themselves, but they can serve that really important connective tissue. The water utility there, Denver Water, also helps to provide information about the resources that the Department of Public Health has through their lead paint grant program in its mailings to residents, again, providing that more sort of holistic messaging about the potential for lead exposure. And like the example I highlighted in Cincinnati, they also participate in a coalition together, which helps them to identify additional opportunities for collaboration. Next slide, please. And I would just like to sort of, share my own observation here too, that I think it's really important on both sides of the equation here to not be afraid to think outside the box. I think sometimes public health agencies, maybe some of you on the line here today are really great at this. You already have a really good sense of who sort of your community partners and messengers might be. And that's an asset that you bring to the table too, when you're initiating these kinds of collaborations with water utilities, your ability to reach into communities to sort of leverage those community messengers. I'll share just a couple of examples here to illustrate what I mean. Back in the early years of the Flint water crisis, for instance, my organization had the opportunity to provide some mini grants to communities to help bring some awareness to lead poisoning prevention and effective policies to reduce and prevent childhood lead exposure. And we were approached by a group in Flint, Michigan. Again, it was sort of in the earlier days of the water crisis that had been organizing. They didn't have 501c3 status yet, but they had been organizing really around their concern that there were not culturally competent and holistic messages for the Latinx community there. And they were really concerned about that. And they asked us if we would be willing to fund a ballet company. Now, as executive director of a public health organization, I probably never imagined that I would be providing technical assistance to and through a dance company, but we listened to the community. They told us this was the right messenger, and we funded the ballet company. And the ballet company became a really important hub and organizer and messenger for getting the word out to this community, and really, really incredible work resulted from that partnership. And would love to say more in the Q&A about some lessons we learned there also about effective messaging to consumers. Another example here is, in work that my organization's been doing with other Lead Service Line collaborative members, including the Children's Environmental Health Network. We've been doing a lot of work recognizing that homes are often also early learning environments, whether children are receiving care in their own home or in a relative's home, or in a home-based childcare, and really thinking about the unique challenges that home-based childcare providers face when they're thinking about investigating to see if they have any issues with lead, and thinking about how to notify staff and parents about a potential lead exposure, how to remediate that, how to finance all of that work. And so we've had to really think about partnering beyond just this housing and public health space, reaching out to home-based childcare providers and organizations that really focus on early learning environments so that we're addressing the issue more holistically. So don't be afraid to think outside the box. And I would argue that often your public health agencies are a great way to help you do that if you're a water utility. Next slide, please. And speaking about, partnering, I just wanted to acknowledge that sometimes knowing where to start can be hard. Hopefully a lot of you joined this webinar today because you were already sort of bought in to why this was important and who you needed to partner with. Right? Hopefully nothing we've said here has been that earth-shattering to you, but it can still be challenging to know how to do it and how to get started. And so one of the things that I would just like to leave you with as an offer here today is that the Lead Service Line Replacement Collaborative has put out what we are calling our matchmaking survey. You can go to the next slide, please. And this is a really brief survey. I think it takes 5 to 10 minutes total to complete, depending upon how much information you want to give us. You can take it if you are a public health entity, if you're a water utility, if you're another type of stakeholder, and you're interested in sort of getting this kind of conversation between public health and the water utility sectors in your community started, but you're not sure how to get started. I want to be clear, you're not committing to anything by filling out this survey. What this does is it'll send a notification to our team, say, hey, somebody's interested. We'll reach out to sort of check in with you to see where you're at. Often that leads to us just having an informal conversation with you to understand the landscape in your community, what you've tried, or maybe you haven't tried anything yet at all. Do you just want help strategizing a conversation or finding out who's the right contact? Do you want actually support for somebody to join an initial conversation between you and somebody on the other side? If you're a water utility, helping you to connect to public health or vice versa. Really, any and all of the above is fine. Sometimes folks will get on the phone with us. They just need one phone call. We give that, we're happy to share some resources, share some thinking about how to get the conversation started, what might be some early opportunities in your community, and that's all they need. Other times, folks want to stay in touch with us and want a little bit more support, but we'll put that offer out there. If you're having trouble getting started, but you are interested and know that this is important, we're happy to help do a little bit of that matchmaking. And with that, we'll go to the next poll question here. So it's coming up on screen. I will go ahead and read the poll question out loud here. So hearing everything that we just heard, would you say that lead service line replacement is the only issue that public health officials and water utilities should collaborate on? Is that true or false? So we've spent a lot of time talking about lead here. Do you think that lead service line replacement is the only issue that public health officials and water utilities should collaborate on? Go ahead and give people 15 more seconds here to log your response. Okay. We can go ahead and close the poll. And hopefully all of you definitely agree that lead is an important place for water utilities and public health officials to collaborate, but certainly not the only opportunity. And that putting this kind of partnership in place right now will help to build the foundation that you may need to navigate future challenges or opportunities. And with that, I will turn it over to my colleagues.
Hi, Mason, I'll start, right? Yep, I'm Lynn Thorp. I'm with Clean Water Action and Clean Water Fund. I'm based in the Washington, D.C. area. Clean Water is an organization just celebrating our 50th anniversary. We work on a wide range of environmental and health issues. Our national programs focus on water pollution and drinking water issues. We also have programs and offices in a dozen states. And we joined with this diverse group of partners in the Lead Service Line Replacement Collaborative in 2016. We helped to found the collaborative, and I serve on the steering committee. It wasn't long before the collaborative as we considered our broader mission of trying to figure out how to accelerate full lead service line replacement, and understood that we were working on both a major drinking water issue, but also a major public health issue, lead exposure. We began to very early on consider questions of health equity. You all, public health professionals on this webinar, know that health equity is a driving principle in your work. And we began to ask ourselves, what does this mean for the business of each community, each water system trying to get these lead service lines out? A guiding principle for us as we thought about that question was that when there are lead service line replacement initiatives, so a full replacement program that a water system is undertaking, for example, that if there are barriers to participation and barriers to people, consumers, receiving the benefit of getting that lead service line out and thus having less lead exposure in drinking water, then one of our tasks needed to be to figure out what those barriers were and to help communities figure out how to overcome them. And we've thought a lot about how there is a difference between equality and equity, and that has helped to guide our work in this area and our thinking. I know you all know, but I'll quickly refresh. Equality means that everybody, groups or individuals have the same access to the same thing, the same resources or opportunities. So everybody has the same ability to get their lead service line removed, for example. Now, equity is a little bit different because you have to recognize that there are different historical and current circumstances that might impact a person's ability to receive a benefit. In our case, to benefit from the removal of that lead service line, so that you may have to make adjustments to what you're doing. One, but not the only obvious place this came to play as we began to consider questions of equity was that historically, as it was noted earlier, we've often thought of the lead service line, the pipe that comes into the building, as being divided into this public part that's owned by the water system and the private part that's under private property and is owned oftentimes by that building owner. And so if you ask the building owner, the homeowner, to contribute to the cost of replacing that lead service line, it might affect whether they can take advantage of that benefit. So many other examples we came to learn as we began to think about these questions of advancing equity. Next slide, please. So what we found is that in just about every aspect of getting the lead service lines out, equity issues arise. And so, as I noted, both financing and funding are important because oftentimes, historically, the way we finance removing lead service lines, if the part of the line is under private property, is to ask the consumer, the customer, whoever's paying the water bill, to spend, it could be thousands of dollars to help replace the side that's under their property. That has obvious equity issues. We've learned that can impact who says yes. And because we also know that historically, people in low-income communities, people of color often have historically high exposure to lead from other sources. We started to realize that right then the question of whether you get the lead service line out of the ground when people are also experiencing other exposures poses equity issues. We saw how it could have to do with which communities, which pieces of a water system, which neighborhoods, which streets got their lead service lines replaced first. we understood that there can be impacts when you're doing those replacements, and that you need to consider those impacts on different kinds of communities. For example, what if you are digging up the roads and disrupt bus lines on which people rely for a period of time? That can be a question of equity being experienced in certain parts of the community. And we've also, we mentioned earlier that if you were to, for example, to only replace part of the lead service line, either because you have no intention of replacing the part under private property, or because the customer does not want to or cannot pay to have their side replaced, you could be raising lead levels in that water. And that would mean that those people who choose or cannot help to pay for the cost of replacement are having more exposure to lead in their water than those who can pay to replace the part of the line under their property. An interesting study that American University did with DC Water on how that customer ability to pay played out in DC demonstrated that in neighborhoods with lower income and neighborhoods involving large populations of people of color, less people were able to get their lead service line replaced. It was a very obvious inequity in their program, which they then worked to address. Next slide, please. So we have tried to demonstrate and explain how centering equity as you design a lead service line replacement program can help with multiple goals. Obviously, ensuring equitable access to safe water, which is a goal I think all of the collaborative members share, and that it demonstrates that it can also address other problems in the community. One thing, the lead and copper rule revisions, those are the Safe Drinking Water Act regulations around lead in drinking water that were mentioned earlier, literally require that water systems prioritize disadvantaged communities as they implement these new Safe Drinking Water Act requirements. I will note that the lead and copper rule revisions themselves do not define disadvantaged community, and that's something that will begin to be explored and dealt with as the LCRR requirements go into effect over the next few years. But also, as you no doubt have heard, some of the funding in the Bipartisan Infrastructure Investment and Jobs Act, for example, prioritizes disadvantaged communities. The lead service line replacement money from that law, the $15 billion, 49% of it is principal forgiveness and low interest and grants to disadvantaged communities. Again, some questions about how each state defines disadvantaged community, but being able to understand disparate impact and inequities in your community will help people secure funding and meet wider goals. And I will turn it over. I'll turn to the next slide.
Sure. Thanks, Lynn. My name is Mason Hines. I'm with Resolve. I'm the facilitator of the Lead Service Line Replacement Collaborative. I am also the one bugging you in the chat to submit questions. And so I'll do that again verbally. Just if you have any questions, please feel free to send them in. We really want to keep folks engaged as we go along. What we also want to do is talk about a new guide that the collaborative developed to help communities think through these questions of equity as they're designing lead service line replacement programs. And actually, because I'm excited about it, what I want to do is, as we're going through this, invite you to go to the collaborative's website itself and poke around a little bit. This is baby brand new content. It literally went up today, so you'll be some of the first to see it live. You know, we need to jack up our Google Analytics, so help us do that. And I encourage you to just go, you know, open that second screen, third screen, whatever you have, and take a look as we're going along. It's at lslr-collaborative.org/equity. And I'm also gonna just put it in the chat here for everyone so you can get to it easily. Next slide, please. So we know that equity is a complicated topic. It's a complicated goal to achieve really in any context, but certainly in lead service line replacement. And so we tried to make this guide as simple and as practical as we could. We organized it around 5 essential questions, and some of them we've already touched on today, so we're gonna skip over. For example, number 1, what activities does a lead service line replacement include? This step is here just so that folks get a clear picture of what a lead service line replacement program entails, and it's the things that Roya went over earlier in the presentation around inventorying and obtaining funding, the actual construction itself. So we're going to consider for today that step covered. Step 2, what aspects of a program? Oh, the link says it's not working. Roya, can you help me just troubleshoot on the link? Maybe I copied it in wrong. Sorry about that. So step 2 here, what aspects of a program might have disparate impact and why? Like, this is sort of what Lynn just spoke to around, who pays, around decision-making, around sequencing and replacements, communications. We won't rehash that either. What we're gonna jump in is at step 3 here. And so where are impacts anticipated? This one is, I think, somewhat common sense. In the context of a lead service line replacement program, the impact is really, is primarily wherever there are lead service lines. So, identifying and inventorying lead service lines in a community is not necessarily an easy process. And that's a different topic in a different webinar. But once you've done that, you more or less understand, okay, where is the impact, right? Where is this happening? Where is the program going to have an effect? And that will help you then be able to move into where we really want to drill down a little bit more, which is steps 4 and 5 for who might be impacted, and step 5, how can adverse and disparate impacts be addressed? Then I just want to pause and see if there's anything in terms of intro you want to say before we dive into step 4 here. No. Okay, next slide, please. So as Lynn said, we try to apply an equity framework here, and that acknowledges that different people face different circumstances and may need different supports or resources to reach the same outcomes. And so when you're using that framework, understanding the who you are serving becomes a really important question. And in the guide, what we've tried to do is point to data that we think is probably publicly available that might help. And so that's the information that's in the left column here, the consider, that might then help tell you something about who is in your service area and what circumstances they might face that are relevant to lead service line replacement programs. So that's what's in the right column. So for example, you might look at what types of buildings are in the service area to give you a sense of, are there specific buildings or specific areas in the neighborhood that might have a lot of folks who are higher risk populations. As Amanda said, we know lead poses a higher risk to younger children. So thinking about, are there schools, are there childcare, home-based care facilities? Are residents primarily homeowners or renters? We just did another webinar on rental properties and how renters may face additional barriers to participating in replacement programs. And I encourage you to go check that out on the Lead Service Line website. But the gist is basically renters often have less say over what happens on a program, including authorizing lead service line replacement. So that can present a challenge when landlords aren't engaging. So look at building type. You might look at income or employment status data to give you a sense of residents who may or may not have, or sort of residents' relative ability to pay for lead service line replacement. Reported language proficiency in a community or in a part of a community might inform how you can do communications about your program, whether you write flyers or handouts or do websites in different languages, or hold community meetings in different languages, or provide translation services. Another thing you might ask is sort of, are there other known environmental justice concerns in the community or in parts of the community? Unfortunately, we know that oftentimes these things kind of stack up on communities, right? So older homes that are more likely to have a lead service line might also have lead paint or be located near industrial areas. And these things cumulatively are putting people at higher risk. Lynn, sorry, I'm just going to keep pausing to see if there's anything more that you want to add before we keep moving. Okay, so the next thing that we're going to do here is go to a poll question. And this one is less quiz and more just trying to get a sense of who's in the audience. And we just want to know, do you have experience working with demographic data to make decisions about where and how to target public health interventions or other types of programming? And again, we'll give folks like, well, this says 5 minutes to respond. I think that might be a bit much for a 3-question poll, but we'll do, 10 seconds here. Okay, I think we can probably close it. I'm not sure if the results show, because it'd be cool to look at who said yes. Looks like, oh, a little bit of a mixed bag here. So mostly yes, but about 50-50, or not, it's not really 50-50, but same number of people saying no, and then some not sure, and a lot not answering. So, I mean, maybe check an email or something. So moving on to the next slide here. That is essentially, so this practice of using that demographic information to make decisions is what we're trying to, the process that we're trying to walk people through in using this guide. The guide talks about how you might overlay service line inventory data, so the where the impacts are happening, with the demographic data, so the who might be impacted, to inform the program design. And one of the things that we have done, in addition to making the guide, is we've compiled a large list of existing resources and databases that communities might draw on to help do this. If we go to the next slide, there's an example. And this is just one example of, oh, actually, let's go, yeah, there we go. Probably like a dozen different data tables or sort of places where we've compiled information that describes both some national level equity indices that already exist. That's what's on this screen. So I'm sure a lot of you are familiar with these, with things like the EJ screen, CDC's Social Vulnerability Index, other tools. We provide a link to them and a little summary and some of the indicators that are used. But beyond these additional indices, we also have a lot of databases, whether it's like national databases on demographics or income or employment, or like just anywhere that you might be able to pull information that is helpful in then using this guide and informing your lead service line replacement program design. We've tried to pull that together and put it all in one spot here on the collaborative's website. So I am just checking the chat. There's one last thing related to the who, this step 4, before I move on to step 5, and that has to do with defining disadvantaged communities. And I think Lynn, you're gonna talk about this for a second.
Yeah, hi. Yeah, you'll hear us refer sometimes to disadvantaged communities, but even more importantly, it's being referred to in, oh, and next slide, please. It's being referred to in policy discussions as well. And just a couple quick things to get across about that, because it is a big subject, but we recognize that this is not the ideal term, and that some people don't like terms like disadvantaged communities and vulnerable populations for some very good reasons. We are using it here primarily because it shows up in federal and state policy matters that are important, most notably, as I said earlier, in the Safe Drinking Water Act lead and copper rule revisions, and also in some of the prioritization around the new water infrastructure money from the Infrastructure Improvement and Jobs Act. For you all on the webinar, I think one of the most important things at the community and state level is to work with water systems and with not only regulators of, for example, state agencies who regulate drinking water, but also with state investment authorities, because those investment authorities are where the state decisions on disadvantaged community for the purposes of the drinking water state revolving funds are made. And it will vary by state. EPA has issued some interesting guidance for the funding decisions, but this is something that will be developing over the next year or two. So thank you. Next slide.
Yeah. And step 5 here, or this next slide, moves us into step 5, which is, it's really the operative step. It's how can adverse and disparate impacts be addressed? And there are a lot of different ideas, the sort of all the bullets here on the online version of areas where that you might look at, and some solutions to making those parts of lead service line programs more equitable. But we're just going to pick out 3 here, the 3 that are boxed in orange to talk about today. So funding, policies, and inclusive program design. Next slide, please. So not surprisingly, and Lynn spoke to this earlier, funding is one of the primary barriers to equitable participation in lead service line replacement programs, especially if the homeowner is asked to pay directly for a portion of replacement. And I know we've touched on this a few times, but again, if you have to take money out of your pocket to participate in the program, then naturally those that have disposable income, have the money available to participate in a program, are going to be more likely, more able to do that than those who do not. And there's the research that Lynn shared earlier on that point. And there's other sort of a whole other section of the collaborative's website, not in this guide specifically, but another tab on the collaborative's website that outlines a lot of different ways that communities are covering the cost of lead service line replacement. There is federal funding available. Some are using rates or fees or taxes. And in some cases, we highlight potential ways to increase the efficiency of lead service line replacement to get more bang for the buck in each dollar that is invested in lead service line. But what we really highlight in this part of the website is that we're just really emphasizing that lead service lines are a public health risk and should be treated as such in community planning generally, right? So there's an opportunity in the community's broader capital planning process to prioritize lead service line replacement and direct sufficient public dollars to get the job done. Now that's a big process, and there are I understand a lot of competing public health priorities and other priorities in a community. But that is just kind of one of the ways that we are thinking about how this can be done equitably and really building it into a community's broader capital planning process. And again, I encourage you to check out some of the other funding resources on the lead service line replacement page. Lynn, I think you're talking about the policies. Next slide, please.
Next slide. Well, as Mason mentioned, policies are one thing that can help you, a tool that can help address potential disparate impacts and inequities. And policies can be at the water system level, the local government level, they can be state policies, and of course, federal policies. And I will not read through each of these for you. You can take a look, but I think they can fall into a lot of categories. So, for example, policies around financing and funding, how you pay for the replacement programs and how you get other sources of funding to do so. It can also be a policy around the practices of actual replacing lead service lines. So for example, how do you deal with landlords and renters? How do you deal with buildings that you can't get in? maybe people don't want to give permission, but you want to get these fully replaced around the community. And policy can also address questions of transparency and communication and notification of customers. So many paths to go. And next slide, please. We wanted to highlight a little more, just a few of those kind of policies ideas. I think I mentioned earlier that water utilities have often felt that they needed to use the rates paid by their customers to replace the lead service lines. It makes sense. Water systems use the rates paid by all of us to do much of their operations and maintenance. So, and one of the problems that they faced, unlike almost any other thing that the water utility does, is that the lead service line can sometimes be under private property and be in many places determined therefore to belong to the private property owner, the homeowner. And so therefore, if you have a local or state policy that says you can't spend the ratepayers' money on the activity that's on my property, on someone's private property, you've got a problem there. So policies can address that. For example, in some places, utility commissions, for example, in Pennsylvania, utility commissions oversee some of the activities of utilities like water and power and other things. They've said for lead service line replacement, because it addresses a critical public health issue that is shared by all as a concern, you can use ratepayer money and to replace that piece of the lead service line. So right there, you've solved a major barrier to participation. Just letting people know that their service line is lead or might be lead can have an impact on people's own support for the water systems program to replace that service line, support for it being paid for throughout the community, and also for letting the water system be on their property to conduct that part of the replacement. And of course, I think as Amanda mentioned earlier, that getting our public health professional colleagues involved in identifying lead service lines. Oftentimes, a visual inspection inside the home, for example, during other lead risk reduction home visits, can at least be a first piece of data for a water system to identify that a lead service line may be present at that property. So it can be a real big help. And small policy changes at the local and state level could help us get those things done. Next slide, please.
And this idea around inclusive program design is really just in reinforcing the notion Amanda hit on earlier. We really see lead service line replacement as a community-wide undertaking, right? It requires a lot of different expertise, especially to implement an equitable program. And so the more public health departments and community groups and government officials and other partners that are involved, the better. And they'll bring different skill sets, be able to reach different audiences, be able to kind of target the program in a more coordinated way if you're working in partnership across sectors. And there's a page in the equity guide that talks about coordination and partnership. And we have even kind of template outreach letters that we've developed that utilities can use to kind of broker those partnerships with, whether it's public health departments or community groups, and engage them in this work here. Next slide, please. So just a few kind of closing or other key points. Again, just this call in to those of you on the line. This equity analysis is really a core competency of public health professionals, and it's not necessarily the bread and butter of utilities. And so it's important to meld these skill sets together in the design of lead service line replacement programs. And since I think we're talking to a largely public health audience, this is a call into that work. The other thing just to note is that the work itself is also an opportunity to enhance equity or to practice equity, actually selecting who does the physical work of replacement. This is usually carried out by contracted crews and small businesses, so make sure that small and minority-owned businesses are able to compete for these bids. And we did a webinar on this last year, which is what's highlighted here. The last thing is just that to acknowledge it kind of seems like a lot, but truly the best thing for everyone is simply stated as I can say it is just to get the lead pipes out as quickly as possible, right? So while it's intentional or important to be intentional and thoughtful in the design of the program, the design and thinking about are we doing it exactly right? We don't want that to induce paralysis by analysis or to delay the start of removal. This is an active public health threat and issue in many communities, so speed is key. And I think that does it for our presentation. Thank you. And I think we are turning now to questions. And Roya, are you moderating this for us?
I am. It sounds like maybe folks were having trouble with the Q&A. Not sure, but I saw a couple questions in the chat, starting with yes. There will be a copy of the presentation available. Thank you, Kevin, for responding to that. Sounds like it'll be available mid-November. And then the first question that we got is around funding. So the question was, I heard that the amount of funds in the current replacement plan per line is greater in areas that aren't in as bad of shape. Example, $500 per lead line. And in areas that are impacted most by lead lines, the replacement per line is lower. Example, $100 per lead line. Is this true? If so, what is the rationale? Lynn, do you want to?
Yeah, I can start. I'm not aware of an actual per lead line rate in any funding package. Although I was just thinking of some math that I could do. But what is true is that a couple of things. The cost for replacing lead service line varies by place. So leaving aside any funding that's available, we've been very surprised in our work to learn, and I think our partner, the American Water Works Association, can confirm that costs can be from perhaps as low as $3,000, that's rare, but happens, to as high as $10,000. And this can be a result of many things, including permit fees at the local level, labor costs, materials costs, many other factors. So that's one thing to know. Around the country, in any given community, or in any given state, the cost of replacing lead service line at a given water system can vary a lot. Now, what we do know is that the way the drinking water state revolving funds are distributed, and that includes the $15 billion available for lead service line replacement, those distributions to all the states are based on a probably out-of-date formula. And that formula is about all drinking water needs, which vary by state. And so it isn't targeted at lead right now. And there's some really great work going on to try to revise that. But there has been some critique that for the first year, some states got more lead service line replacement money, more of a chunk of that 15 billion than they might need to accomplish, say, the first few years of replacement, whereas states with a huge number of lead service lines didn't get as much. We do have reason to believe that will be addressed over time in the years 2 to 5 of the Infrastructure Investment and Jobs Act funding, but that's a reality. I'm not aware of anywhere where you then get that down to a per lead line thing. The money is in the state revolving funds, and then we'll go through those processes to be provided to drinking water systems. So, but definitely some challenges there that need to be worked out over the next 2 to 5 years.
I guess the only thing I would add to that is I'm not sure the program that Tino's asking about, and I assume maybe it's a California plan, but not sure, and I don't have the details on the California plan, but I would just say that if that is the case, like in some communities where there are more lead service lines, they're providing fewer dollars, or where there's fewer lead service lines providing more dollars. That to me just strikes me as an example of that kind of analysis, that overlap of the where this is happening and the who it's impacting, may not have been looked at carefully, or there's an opportunity to look at a little bit more carefully, to kind of make sure that the resources are in line with where the need is, right?
Yeah, and I wanted to answer the follow-up question. In the Infrastructure Investments and Jobs Act, there was $15 billion nationwide for lead service line replacement. I believe Yolanda asked that question. And then each state got a portion of that for year one. First, remember, we've got 5 years of funding. So there's a portion of that is the year one, and that was divided among the 50 states based on, as I said, an older formula that's about all of drinking water, not just about lead. So no one state got anything close to that. And we know that it won't be enough to replace all the lead service lines. I should probably mention that our community, the environmental community and advocates we work with, certainly thought it was more like 45 billion or more, but it is a good down payment. It's a good start.
Awesome. All right, this next one is for Amanda. Amanda, are there any other unorthodox programs or organizations that have been partnered with by utilities or health departments to spread lead service line replacement awareness, much like the dance school that you discussed before?
Certainly, and I can't claim to know all of them. First, I'll reiterate my invitation that if you have more stories like that, we love to share them. But just reflecting on the work that I do in sort of public health and at this intersection of housing and health, more broadly, I think the answer is really about the goals of the program that you're trying to put into place and the community that you're serving. So, for instance, if you are really focusing on trying to target homes that have small children, many times programs will consider partnerships with the Women, Infants, and Children, or WIC programs that may be servicing lower income families that have smaller children, or Head Start programs. Many times Head Start programs have a home visit component to them. Thinking about other types of programs that are already going into homes that can maybe start to do some of those very quick visual inspections, bring literature into homes, get some of that messaging and serve as sort of a connector. Certainly in a lot of communities, faith-based organizations and messengers may be very effective. And we have lots of examples in our healthy housing space of partnerships with faith-based organizations really becoming strong messengers. Or again, just thinking about how, and engaging with the residents or the target population that you're trying to serve, and then doing some deep listening. So I can point to, examples in Houston, for instance, around lead work that they're doing there, where they've used a block captain approach to really train and pay residents to become really expert in lead and walk the neighborhood, where the residents that are trained as block captains are simultaneously gathering sort of hyper local data that would not be available otherwise about lead risks, but also know about community resources so that they're able to give that real-time connection to services. Or our colleagues in Cleveland who've done incredible work really thinking about how to do some of the cross-sector partnerships and empower residents and really listen deeply to residents about what their priorities are. I will also just say, if this is an area of interest, there's an entire field out there called human-centered design that really has a nice framework for walking through this approach and really can help open up different sort of avenues to getting to solutions. A lot of times, again, coming from the public health world, we have our goal of what the outcome is that we're trying to achieve, and we have our sort of standard public health practices for how we want to get there. But sometimes really engaging deeply, listening deeply, and being open to new solutions helps us to achieve that goal. I'll highlight an example I learned about within the last year of actually coming from California, some work in California and Los Angeles for a different public health issue where a public health entity wound up partnering with a nail polish brand to really get message out to a specific community of women and who happen to like to get their nails done. And this was a way of actually sort of reaching them and engaging them in conversation, right? Really being open to a wide spectrum of partnerships. And that human-centered design approach can really provide an opportunity for that kind of deep listening and identifying new solution pathways. So feel free to reach out if you want to talk more deeply about any of that.
Thanks, Amanda. I also just want to add the Lead Service Line Replacement Collaborative recently put out we recently hosted a webinar on reaching rental properties. And so there's a lot of really great examples in there as well, specifically in Newark, New Jersey, about partnering with the New Jersey arm of Clean Water Action. And a lot of really great conversation in there as well about how to really use community or really have those strong partnerships with community-based organizations to help spread the word and really build public will around lead service line replacement. So definitely check that out as well. The recording is posted on the website. I don't see any other questions. However, on the very last slide, we do have our contact information. So if you're just trying to reach the collaborative as a whole, you can email us at this email address here, or on the last slide, if we could flip to that really quickly. If you're wanting to reach out to one of us individually, you're more than welcome to. Our email addresses are listed there. And then I think
we did have one more question that just came in, Roya.
Oh, yes. I see that.
Oh, and I think Amanda answered it in the chat.
Oh, great.
So the question was, we've had, I don't know what an LHJ stands for.
Local health jurisdiction.
Perfect. So some state local health jurisdictions have completed the matchmaking survey, but based on the follow-up, it appears there have been some challenges with making those connections and taking steps forward. Are you able to provide an update on what to expect regarding next steps for those that are in this position? And Amanda will follow up.
I just noted that we will follow up with our team to see if a disconnect happened with scheduling a follow-up or what might have happened there.
Awesome. And then another question is, how invested have you found that water utilities are when it comes to partnering with public health departments to outreach to communities? Are there designs or messaging examples that public health departments can use to bridge those connections to reach residents and homeowners about public health risks during lead service line replacement? So I feel like there's a couple of us on the line that could answer that. Amanda, maybe since you were the last one off mute, maybe if you want to provide some input there, and then I know I'm sure Lynn and Mason have something to add there as well.
Sure. I mean, I think the not surprising answer is that it's variable, right? There's not sort of one attitude. I think some water utilities that I've had the pleasure of interacting with, are really eager to have this kind of support and collaboration, and others, may need a little bit more convincing to see what the value is. In general, though, I think my experience, again, coming from the public health side in meeting colleagues on the Lead Service Line Collaborative and others through this work, is that water utilities are often very happy to be presenting this more holistic message about lead, right? That lead exposure is not just about lead in your drinking water, that they are very open and eager to that partnership, but they don't know where to start. And so I think as a public health community, we have a lot of the messaging already, right? Many of us do this work every day. We can give these messages in our sleep. It's just about packaging it up, whether it's putting those in their mailers or, putting data on online together about where lead risks might exist in the community, or even as simple as having messages. If it's a lead service line inventory, still having messages about community resources that might exist. There are a lot of things that we can do to get started there. I also will acknowledge, through our work with the Lead Service Line Collaborative, I believe over the next year, this is an area that we're looking into about what kind of sample template messages that we can put out that water utilities and public health agencies can use together, adopt for your own purposes, add in your own links about community resources so that it's even more accessible. And thank you, Mason. The last thing I was going to put in highlight here, and I see you put a link in the chat, is that on the Lead Service Collaborative website, there are already some communication tool resources available for a download. So you can see the link there.
Yeah, I guess the only thing I would add to that is that just as we've done here today when talking to who we think are largely public health professionals, in all of our, the collaborative sort of interactions when we're talking at utility forums or with water systems, we send the same message to the other direction, right? We've really seen that where there is that strong collaboration, the strength of the program and the ability to kind of move forward and leverage kind of complementary skill sets really improves the program and the equity and just the effectiveness of sort of the effort to get lead service lines replaced in a community. And so we're saying the same thing in all forums, really trying to emphasize the importance of that collaboration and trying to provide the tools like you mentioned, whether it's the the template outreach letters or the downloadable one-pagers or the resources in different languages to both communities to help them work together in that way.
All right. I don't see any other questions in the chat, but like I said, if something comes to mind, afterwards, that always happens to me. So feel free to reach out to the collaborative as a whole or one of us individually if if you kind of have a sense of who you'd like your question directed to. I think with that, I just want to say thank you again to CDPH for inviting us to speak today on the importance of lead service line replacement. And with that, I think we're all done here.
Yes, thank you all so much. It was a great presentation. Thank you.
Thank you, everyone.
Thank you. Bye.